Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Hi, welcome to another edition of Meet the Docs, sponsored by the Columbus Community Hospital. I'm your host, News Channel Nebraska's Grant Otten, and I'm being joined by Dr. Snow. Dr. Snow, thanks for talking with me today.
Thank you. Nice to meet you.
So we're here in the Visiting Physicians Clinic, and you work quite a bit in Omaha, but you do come here to Columbus. So can you talk a little bit about what it is you do in the field of rheumatology?
Sure, yeah. I'm based out of Omaha. I come to Columbus twice a month on the second and fourth Tuesdays. In rheumatology, it's mainly trying to figure out why someone's feeling the way they feel. I specialize in autoimmune disease, arthritis of all types, and so basically my day is trying to figure out why someone is feeling the way they feel, and trying to make them feel better in some respect.
Well, you work a lot in Omaha, and you studied in Omaha as well. Can you talk a little bit about your educational background?
Sure. I grew up in Grand Island, went to Grand Island Central Catholic, and then from there I went to college in North Carolina, and after finishing there in 1998 I came back to Omaha, and at that point I actually haven't left Omaha. I went to University of Nebraska Medical Center for med school. My residency training was there, and my fellowship training was there.
Very cool. When you talk about someone in Columbus who might come to see you, who might just be sitting at home experiencing some pain, what is that pain, or why would they need to come get some treatment from you?
Well, we all have pain for different reasons, but I specialize in arthritis and in most autoimmune disease, and so it may be that they had an old football injury that's causing them pain. They're trying to figure out why they're hurting. And my job is to figure out exactly what's going on in that respect. It may be that their hands are stiff in the morning and they can't figure out why, and it's happened over the past 6 months, and there was no injury. And so on a daily basis, I try to figure out what's going on, and then together we decide how we're going to fix it.
Cool. Well, when a lot of people think of joints or maybe injury stuff, they think of orthopedists or someone like that. So what is, I guess, kind of the difference with what you do?
Yeah, a lot of times we start and we treat the same thing, and there'll be times where I will refer someone to an orthopedist and vice versa. Mainly orthopedists, they deal with people before surgery and after surgery. They deal more with a mechanical issue of the joint. My specialty a lot of times deals with autoimmune problems of a joint, and so things that can't be fixed by surgery. But when your knee hurts, you don't know whether it's surgery or whether you need to be on a certain medicine, and that's where we come in, and we try to figure that out, and I try to help you with the best I can, and if I think that you need to see a surgeon, you see a surgeon, and the orthopedist will do the same.
Back when you were studying in college, you did some mission work as well. How did that affect where you're at in your practice today?
Yeah, when I was in medical school, the University of Nebraska Medical Center has a group that goes down to Jamaica every year. It's an established clinic that has been going on for decades. And my second year medical school, I helped coordinate that trip. I went as a first year and I helped coordinate as a second year. I think that you get back to it's the roots of medicine there. I mean, we don't have fancy MRI machines there. It's you talk to the patient and you figure out what you best can do. And I think that gave me a sense of helping others, but also gave me a sense of getting to know patients and talking to them and trying to figure out what's going on, and realizing that really the art of medicine really doesn't come from the tests. It comes from talking to people and figuring out why they feel the way they feel.
Well, talking about kind of going on those new journeys and doing new things, is there anything new that you're kind of working on particularly?
Yeah, I am. I started a scleroderma clinic, and scleroderma is a very, very rare autoimmune disease. And all rheumatologists take care of scleroderma, but I'm developing a research interest in that, and while the majority of my time is spent taking care of patients, I'm trying to build some research into that and get connected with the national, international experts, and hopefully becoming an international expert on scleroderma.
And that's something you're doing here in Columbus as well as Omaha?
Yeah, I have a specialized time in Omaha where I see scleroderma patients, but I will see them anytime. So I have a specialized afternoon where I see them and have a little more time per patient slot. But I do see scleroderma patients out here, and so it's an interest of mine. I take care of all autoimmune disease for the most part, but it's something that I've kind of tried to develop a little niche in.
Well, talking about your time in Columbus, have you enjoyed working here in the newer physicians clinic?
It's beautiful. It's beautiful. Yeah, I started coming here in 2011, and my office space back then was nice, very nice. But starting a year and a half ago, the office space here is phenomenal. It's absolutely top notch, and I've seen the growth in the area, in the Columbus area here, the medical center, all the buildings that are popping up around the hospital, including this one.
Yeah.
And so it's been great to come out here, and I really enjoyed it.
And you're originally from Grand Island?
Yes.
And so it's a little bit bigger, but a similar style type of community here in Columbus. And so is that help in your decision to come work here as well? Yeah.
It's being in Omaha, it was nice to get away from the city a little bit, and obviously Columbus is a nice sized city, but it was nice to get away, and it was just a little different change of venue, and I love the people out here. It feels like home, and so I started coming out here 5.5 years ago, and I changed locations in Omaha a couple years back, year and a half ago, and at that point I had the opportunity to decide whether I wanted to keep coming out here, and I really enjoyed it so much that I felt like that it was I enjoyed it, so it was fun for me, so I'm still coming out here.
Well, Dr. Snow, thank you for joining me. It's a pleasure to talk to you. Thank you guys as well for tuning in to another edition of Meet the Docs, sponsored by the Columbus Community Hospital. I've been your host, Grant Otten. We'll see you next time.